A clinical study is coming to Fargo testing at home with strep, and the test is brought to you by Patty Post of Checkable. Welcome.
Thank you.
So tell me a little bit about Checkable.
Sure. So Checkable Health, we're based here in Fargo, and we're doing an at-home strep test, and it's the first of its kind, and it's going to be available once we're FDA approved and we execute the clinical trial at your local pharmacy. So parents don't have to go into the doctor to check for strep.
Right.
That was my overall goal.
So what inspired you to make this product?
Being annoyed with having to go to the doctor because I have 3 kids and we were at the doctor multiple times in the same week because you only can have strep diagnosed in a clinic setting by a doctor.
Okay.
And so if you have strep, you need an antibiotic. You need to be treated because you can get your infection, which is rheumatoid arthritis, rheumatic fever, and it causes a whole bunch of damage to your heart. And if that goes undiagnosed, it's bad. Why don't we bring this home? Why don't we have that test available for parents to do it at home? And that was the overall goal of mine.
Such a great service. So what made you move to Fargo?
Really, I had a couple of investors, early angel investors from North Dakota, and they introduced me to all of the wonderful people of North Dakota, as well as just the opportunities for investment and access to capital in the state.
Nice. So I know strep is very common and it's very expensive to test. So how is this comparable to, the price point of like your insurance prepay?
Well, if you go into the doctor and you walk into, let's say, a Minute Clinic, it's going to cost you about $125, and a normal clinic about $195 to $225. And then you start getting to emergency room visits, and that can cost you thousands, depending on the market. So what this test is, we'll have 2 tests in each box, and we will be $29.99. And so I look at it as like a pregnancy test. Like a woman, if she's looking to get pregnant or thinks she's pregnant, she's not going to go into the clinic.
Right.
She's going to buy a pregnancy test.
Right.
This is the same thing.
This is amazing. So what stage are you in the FDA approval of this?
So we're in our phase 1 of our clinical trial. We have a site here in Fargo at Plains Clinic. And at Plains Clinic, you have to make an appointment if you have the symptoms of strep. So that's a sore throat, swollen lymph nodes, a fever, and make an appointment with Angie and go in and have your child checked for strep. You would run the test by yourself and we would collect the results, and you would be able to be a part of a product getting to market, which doesn't happen very often.
So what is the turnaround for the results?
Immediate. It's a rapid test.
Okay.
So think of a COVID test,
Okay.
a rapid COVID. So from start to finish, it takes about 20 minutes after you read the instructions versus 4 hours when you go into the clinic.
Right, the wait in the emergency room, the prepay, all that. So you've knocked this down to a simplified way to test strep throat at home. This is amazing. So when can we find this on the shelves?
Well, we hope in 2023, cold
Okay.
and flu season. That is my optimistic goal, which is very achievable because we have Fargo as a site, but we also have 8 sites around the country.
Wow.
And then we're growing more. So our phase 2 trial will begin in September of this year.
That's awesome. Checkable Medical.
Yes.
This is an amazing, amazing product. So let me ask you this. When the FDA approves this product, what was the procedure to get it FDA approved? Did you have to go through medical testing with the patients?
Yes, so it already is a test that's in a clinic. So it's been widely adopted for over 10 years now. What we're doing is we're taking that site of care and the user from a doctor, nurse, a clinical professional to it's called a lay user. So that would be you and me. And then changing the site from a clinic into a home. So we have to study that rigorously for the FDA to really trust that people like you and me have the capacity to do it at home and do our instructions, really show you how to go from start to finish, interpret the results. And then, as I said, we have a telemedicine that we will then link to. So then you can get your prescription and you won't have to drag your kid from your home to your clinic to go get the prescription.
Thank you so much, Patty. Amazing. So up next, we're going to be gambling a little bit with Dakota Magic here on North Dakota Today.